Hi everyone, my name is Nina Castrogiovanni, and today I'll be talking to you about my practicum experience with AIDS Vancouver Island. So AIDS Vancouver Island, or as I'll be referring to it as, AVI, operates with the mission of serving people infected and affected with HIV, hepatitis C, through taking evidence-based action to prevent infection, provide support, and reduce stigma. AVI offers a variety of programs and services that support this mission. For example, harm reduction services are a core component of AVI's responsibility to contain HIV, hepatitis C, and other communicable diseases. Harm reduction services include supplies for safer drug use and safer sex, health promotion information and support, and referrals and relevant programming for people who use drugs. Other programs offered by AVI include the Positive Wellness Program and the Men's Wellness Program. So during my placement at AVI, I had the opportunity to take on two primary roles. 2 days a week, I worked at reception, where I had the opportunity to interact directly with clients by distributing and safely recovering safer drug use and safer sex supplies. In addition to this work, my main role was to assist in the planning of a day-long educational workshop highlighting issues related to women and HIV. That workshop will take place later this month. The rest of my presentation will focus on the process involved in planning this workshop. So for my practicum case, I chose to focus on my role in creating a detailed project plan that has guided and will continue to guide the planning and delivery process of the day-long educational event. In order to create the project plan, I had to access and utilize many skills gained from many courses. For example, the skills I used from Health 320, Program Planning and Project Management, included understanding which approach to planning to use, the ability to take steps to uphold cultural safety and plan in a diverse cultural context, and the ability to identify project stakeholders, estimate project cost, create a project schedule, and monitor and control the progress of the project. So recent research from the BC Centre for Excellence in HIV/AIDS has demonstrated that women living with HIV appear to experience a poorer quality of care than their male counterparts. Furthermore, the research team found that women with certain factors were more likely to experience this poor quality of care. These factors included having a history of injecting street drugs, being of Indigenous ancestry, and residing on Vancouver Island. Despite these concerning findings, preliminary research from the Canadian Women's Sexual and Reproductive Health Cohort Study, also known as CHIWOS, indicates that women living with HIV could benefit from care that is women-centered and would more fully address their unique needs in a supportive, inclusive, and accessible manner. In response to this research, the Executive Director of AIDS Vancouver Island saw the importance in holding a day-long educational event in order to explore issues related to women and HIV, such as women-centered care, specific concerns of HIV-positive women, and hepatitis C co-infection. The goal of the workshop is to provide a venue and opportunity for a diverse group of stakeholders to come together and learn about best practices for care by engaging with women who live with HIV, while also providing them an opportunity to influence the landscape of service provision in Victoria. While I feel that all public health and social policy values were incorporated into the planning and delivery of the day-long workshop, I will focus on 3 values of partnerships with people and populations served, critical analysis drawing on principles of social justice and equity, and diversity and cultural safety. By engaging directly with HIV-positive women in order to inform the planning and delivery process, this allowed myself and the project team to form partnerships with people and populations served. For example, at the workshop, a panel discussion made up of women with lived experience will provide insight into what women-centered care means to women living with HIV. The impetus for the research resulted from the executive director critically analyzing the literature related to women and HIV, and then taking steps to further social justice and equity through holding an empowering and strengths-based educational event. Finally, diversity and cultural safety were considered throughout the planning process. I spent a lot of time researching how practical action could be taken to uphold cultural safety. For example, during the workshop, AVI will provide an area of refuge and dedicated staff to debrief with workshop participants should anyone need it. So I want to say a big thank you to my practicum supervisor, Kristen, and to Lynn Davis and Betty Taylor for supporting me throughout the semester, and to my fellow students. Thank you so much for listening to my presentation.
questions for Nina? Hands up. Oh, Kathy.
Not sure if you focus on this, you didn't talk about it, but coming from the world of vaccination, I just wondered if that was part of these services that you talk about with your clients, the importance of being protected against vaccine preventable diseases because of their risk factors.
Right, and I don't actually know, but there are different staff who are involved in health promotion, and I'm sure that they probably do counsel people and provide that advice. I just myself don't have any knowledge of that, but thank you for the question.
Other questions? No? If not, oh, one over there.
Hi, that was awesome. I'm just wondering if you can talk a little bit about what you found about women's experiences living with HIV and just what maybe big learnings for you or...
I think one of the big learnings I took away was that while we do have great services in Victoria, the women that I spoke to with lived experience mentioned they had to travel to Vancouver for women-centered services. And so I think that within Victoria we could really benefit from services that focus directly on women. I think they predominantly focus on other groups such as men, people who use drugs and other things. And so I think having women-centered care within service provision within Victoria would be very beneficial.
Great, thank you, Nina.